am Dr. Kate Fitz-Gibbon, the Director of the Monash Gender and Family Violence Prevention Centre.
I am Professor JaneMaree Maher in the School of Social Sciences at Monash University.
Welcome to you both. If I could just start by asking you to tell me a little bit about the work that the centre does.
Absolutely. Thanks so much for having us, Jo. The Monash Gender and Family Violence Prevention Centre works around driving the evidence base to better understand risks and prevention of intimate partner violence and all forms of family violence. So our team has been engaged in a range of research projects over the last 5 years that in many cases have originated from the incredible work of the Victorian Royal Commission into Family Violence, but also some broader work that has looked at the national and international landscapes and reform agenda for improving family violence responses, but also better understanding risk and how we can prevent the injury and death of so many Australian women and children.
We know that this was already desperately needed before this COVID-19 global pandemic. What changes have you seen and what impacts are you seeing on levels of gender and family violence and concerns about, what the future might hold?
Yeah, I think it's an incredibly concerning time for women and children experiencing family violence in Australia. Family violence was declared a national emergency in Australia in 2015, and we know that that is only likely to be heightened during this period of global health pandemic. The United Nations recently referred to violence against women as the shadow pandemic, and they've been really trying at the global level to push out the importance of making sure that governments devote the resources that will absolutely be necessary to try and keep women and children safe during this period. The reasons that we can expect heightened increase of family violence during this period are, closely related to the restrictions within which we find ourselves living, in that for many women and children, even though the message has been to stay home and stay safe, that's just not the reality for them, and home is not a safe option. And being in close confines with an abuser will present a new range of risks, as well as the new forms of family violence that we're seeing emerge, where abusers are actually using the threat of infecting a child or a partner with coronavirus as an abusive tactic. We also know that many of the gendered implications of COVID-19 are closely linked to the drivers of family violence. And JaneMaree, I'm not sure if you'd like to quickly speak to that.
So we understand that economic inequality, economic stresses, gendered expectations of care, all things that don't cause family violence, but they're part of the gendered landscape that allows it to occur or enables it to occur. And so all of those things that I mentioned, as you can quickly see, are absolutely at the forefront of our mind in this time. So there's widespread unemployment. There is a huge expectation around the provision and management of care in family homes, which will fall in gendered patterns, even though I know there's a discourse about changes, and hopefully that might be the case, but past evidence suggests that it really operates very effectively in one way. And, of course, things about autonomy, money and communication are all now really going to be quite tightly controlled in that context. And so, as Kate has been reflecting in some of her work that's been published recently, some of the things that women were able to do to keep themselves safe are probably not so readily available now.
Given there's this increase, what do family violence services need to do to adapt, or what changes might need to happen to help them deal with this better?
So look, I would probably say it's not family violence services that need to adapt. I think one of the things we need to remember is that for many, many decades, family violence services with no or very limited resourcing have been putting their hands up and saying, "Excuse me, we need to do something about this, and as well as advocating for it, they've actually been doing things about it. We saw very quickly that services went online. We saw adaptive ways of managing, but I would say that, you know, as Kate said, we have the privilege of working a lot with people in the family violence sector, and they are the most determined, adaptable and committed group of workers I've ever seen. So I think it's actually to all of us to think about change. I think federal and state governments need to really focus on funding services, funding the new needs, and remembering to catch up the funding needs for the old that pre-existed this. And I think the state government has really, in Victoria, you know, they have kept on saying we are working on this, and that really helps to keep it front of mind. But I think also there's a role for all of us in the community, and maybe, Kate, you'd like to talk a little bit about your reflections on this.
Yeah, absolutely, JaneMaree. The social distancing, physical distancing restrictions mean that for many people they will be confined to their homes, and it also means that for many neighbours they will be hearing, seeing, suspecting acts of family violence in a way that they haven't previously been either attuned to or have had access to. And what we've really been encouraging in some of our recent work is for people to reach out for specialist advice if they believe that a woman, their neighbour, their friend, their family member, a co-worker is at risk during this period. And that is incredibly important because that person may be unable to reach out themselves. And the best thing to do if you're unsure is to call a helpline like 1-800-RESPECT, where you can speak to a specialist family violence practitioner and ask for advice, describe the situation. The other thing I would really stress is that if people think that someone they know, or if they can hear something on their street that they think someone is in immediate danger, to call the police, and that is the best thing to do to try and ensure the safety of Australian women and children. And, you know, taking JaneMaree's lead, I'd really agree that our sector, family violence sector, do an incredible job on a shoestring of resources. And so what we can do, and also what the government can do to make sure that it's really clear that Australian women and children's safety is a priority during this time.
Thank you so much, JaneMaree and Kate Fitz-Gibbon.
Thank you for having us.